there, my name is Rachel Goldberg, and I'm a consultant at Intrepid Ascent. For the last 9 years, Intrepid Ascent has been supporting communities across the nation share health and social service data to support more comprehensive, holistic care. We are partnering with Leading Age California to offer members exclusive education about the California Data Exchange Framework, or DXF. In this video, we will talk a little bit more about key considerations that healthcare entities regulated by HIPAA should think about as they assess whether they should sign the DXF Data Sharing Agreement, or DSA. Just a reminder, the Data Exchange Framework requires specific healthcare organizations to sign the DXF DSA and share specific healthcare data when requested by other entities. Within Leading Age California members, skilled nursing facilities and PACE organizations are required to sign the DXF DSA and implement data sharing as outlined by the DXF by January of 2024. Other members of Leading Age California, including home health and hospice organizations, are likely not required to sign the DXF DSA, but are highly encouraged to do so. To find out more about who is and is not required to sign, check out the Leading Age California website. To learn a little bit more about why this matters and why you should consider signing the Data Exchange Framework DSA, we wanted to talk more with an organization who has signed. Mark Valladolid is the Director of IT at St. Paul Senior Services, a skilled nursing facility in San Diego. Mark, can you tell me a little bit more about why your organization signed the DSA and what value you see in the Data Exchange Framework?
Yes, of course. Well, for starters, I think, the fact that it's a requirement, I think, is what brought it to the forefront. But when you look at it from a holistic view, I think there is a significant benefit to data sharing, especially when we have a lack of information coming from other care levels, such as hospitals and clinics. A lot of times the things that you would rely on to make clinical decisions timely are often delayed, whether it be blood work or imaging or what medications they gave them in the ER. I think the quicker you get that information, it's better for the patient, because you're able to make better clinical decisions on more real-time information. So we see value in that.
Great, thank you. Those are all really good points. And can you share a little bit more about what steps you've been taking to implement the Data Exchange Framework?
Yes, well, for us, I think that getting this on the radar of the EHR vendor is critical. There is a lot of different interfaces that EHR vendors typically work with, and they have an array of customers in all states. So, without that understanding of that there is a requirement and it's state mandated, I think the first thing we started is to get our EHR vendor in communication with us to understand what the parameters were, what the requirements were, and to start setting the stage for what it's going to take to do it.
Great, thank you. And then finally, if you have one piece of advice to give to other organizations who might be considering signing the DSA, what would that be?
Well, I would start with readiness. Do you have the framework in place to support this? Does your EHR vendor have integration capability already? Sometimes the EHR vendors do state that they are certified EHRs with this capability, but there's some limitations there. So that's where I would start first. And then the second thing is, like I mentioned in the prior answer, getting your EHR vendor aware, make them aware of the requirement, make them aware of why we're doing this, and getting them, to partner with you in meeting these requirements, I think, is essential.
Thank you so much. Good news. As a HIPAA-covered entity, your organization most likely already complies with the DXF's Privacy and Security Safeguards Policy and Procedure document, which states that all participants must have written privacy and security policies that are consistent with HIPAA, including annual training of staff who have access to PHI and PII. However, when it comes to informed consent, there are a few questions that your organization should consider, including how you'll get consent from residents to share information through a health information organization and/or with community-based organizations. Do you have a way in your system to identify and record discrete events and data? What is your process for when residents can't consent themselves? The state of California just opened a grant program to support organizations who are implementing the DXF. For skilled nursing facilities and other required signatories, the grant application window runs from May 15th to September 30th of this year. For home health, hospice, and other encouraged signatories, the grant application window opens July 1st and runs through September 30th. You can find more information about this opportunity, including eligibility requirements and funding maximums, on the state's DXF website. If you have any questions, please send them to Leading Age California or bring them to the next Data Exchange Framework webinar. You can also find additional resources about the DXF on the Leading Age California website. Thank you so much for watching today, and I look forward to seeing you in future events.